So when the small intestine joins the large intestine, it joins at a site called the cecum, and the appendix is an outpouching of the pouch itself, which is the cecum. So there's a place called McBurney's point between your umbilical cord and your iliac bone, and appendicitis usually is a pain caused by inflammation of the peritoneum along that line. So it's going to be in the lower right quadrant, and that gives you a clue. See if everybody's ready. You guys ready to move on? Okay. Question number 2. Branches of the arterial iliac artery supply which of the following?
It says uterus right here. Yeah, it is.
I don't have uterus. I have superior inferior gluteal arteries. For this is internal iliac.
Yeah.
So I gave you the answer to this question in a single sentence on Monday night.
Obturator artery, genitals.
Plus the uterus and vagina.
External genitalia, so B as well.
But it's either all of the above or just uterus.
Yeah, so all of that above. This right over here, it's just apply the hip too. This right over here next to the abdominal region.
Yeah, that's why I'm like.
I think it's all of the above.
Because I would do the
Yeah. We'll go B.
Yeah.
And what did we put for A?
I don't remember. I didn't get a chance to get a good look at it.
Me either.
What did you put?
We're going wild card.
So A and D makes sense now.
This is external genitalia as well, so that's why.
All right. So this is where we finished on Monday night, if you still remember that point in time. You're all pretty tired.
Yeah.
And we have the abdominal aorta ending by dividing to form the left and right common iliac arteries. There actually is a small branch that comes down on the sacrum called the medial middle sacral, which we're not going to do. All right. And now we're ready to follow the external iliac as it passes into the thigh. It passes under a band of connective tissue called the inguinal ligament. And I can show that to you on the female pelvis that we were looking at for the sciatic nerve. inguinal ligament. And as soon as the external iliac artery passes under that, it changes name. Okay, it's kind of like our subclavian and axillary changed names, and it's the femoral, becomes the femoral artery. I do not remember what number we left off with. 57 was the last one we used?
56.
56, okay. So this is the femoral artery. There's actually a region right up here just inferior to the inguinal ligament, which contains the femoral artery, femoral vein, and femoral nerve in a little triangular pouch as it pulls down the peritoneum with it, called the femoral triangle, okay? Remember when we talked in the female reproductive about endometriosis and how the endometrium can move, instead of just coming out the vagina, can move into the oviduct and can settle there and grow in that area, or it can move into the peritoneal cavity, and it can move down and settle in this region here as well. So every time the woman has a menstrual cycle, that's gonna increase in thickness because of estrogen, increase in blood vascularity because of progesterone, and cause pain when the progesterone levels decrease. And the cyclic effect of it should be a clue that it has something to do with it, but it's a weird place, so it is not always caught very often if it does happen down there, because nobody expects endometriosis to be in the thigh, okay? But that's because of that peritoneal component that pulls down into it. There is a branch of the femoral artery, just like there is of the brachial artery, that's going to supply blood to the medial and posterior compartments of the thigh, the deep femoral artery. But we're not going to worry about that, so we're just going to follow the femoral artery down inside the thigh, and it eventually disappears through the adductor magnus muscle. There's another reason why I brought this better model in here. So here's the femoral artery passing just under the inguinal ligament. Okay, so when we see it here, it's femoral. When we see it up here, it's external iliac. And this is a brand new model. Here you can see it passing down deep to the sartorius. And then right here, it disappears into the adductor magnus muscle. Okay, it's not stopping, it's just passing through that opening. And then if we turn to the posterior aspect of the thigh and remove the hamstrings, it passes back in. This is still adductor magnus muscle. I don't remember if you remember from 430. I don't know if you don't remember from 430. Adductor magnus is huge, and it's even more large in size with if we visualize it posteriorly. So here it's becoming visible again on the posterior aspect of adductor magnus. And at that point, as soon as we see it in the posterior compartment of the thigh, it's called the popliteal artery. Or if you prefer, popliteal, wherever you want to put your emphasis on which syllable. And it's going to continue as the, this is so new I can't. It's going to continue as the popliteal artery until it gives off the anterior and posterior tibial arteries, all right? So it's variable how long it is because it depends on when it passes through the adductor magnus muscle. Branches go off around the knee. Now we talked about anastomosis around the shoulder and so on. And so these are called, anybody remember what the bend of the mandible is called? If you had me, I had you learn it. To give a slight curtsy is to genuflect, yeah. So the genu of the mandible, the bend of the mandible. So these are called the genicular arteries for the bending of the knee. So let me draw those in. And because it's going posterior, I'm going to draw it as a dotted line, just like I did with the coronary vessels to show that we're looking through the posterior aspect of the knee. So 58 will be popliteal. And then wrapping around the knee from anterior to posterior. There's usually 4, but there's a variable number. Those will be the genicular arteries. So it'll go a couple inches or so inferior or distal to the knee. And then it's going to give off 2 branches. The anterior tibial is going to pass through the interosseous membrane to enter into the anterior compartment of the leg. And the posterior tibial is going to go down straight. All right, so we'll draw that first. And I'll probably end up drawing it again over here just so you can see it better.